Welcome for you in this course, Gestational Diabetes Mellitus, Theory of Reasoned Action. Congratulations for having this chance, and all I can say, I'm really so proud to be with you in this course. My name is Maram Abdelnasser Tajtaya. I am a Palestinian pharmacist and American Studies instructor who is teaching on Udemy. Anyway, diabetes mellitus is a collection of metabolic troubles described by a chronic hyperglycemic situation generating from troubles in insulin action, insulin secretion, or both. Gestational diabetes mellitus influences within 2% and 5% of women in pregnancy. From the beginning of theory of reasoned action in behavioral survey, it has been utilized to study a broad diversity of situations and is at present considered as one of the extreme influential theories concerning volitional individual behavior. The aim of this course. I recognize that it is secure till that almost everybody reading this course would like to improve interventions for pregnant women to develop medical choice creation and the public's well-being. In this course, I depict a theoretical tactic to the prognosis and perception of pregnant women behavior with a vision to its implementation in health and medical situations. What the reasoned action tactic tries to perform is to recognize a relatively small collection of variables that can be considered for a prime proportion of the variation in any offered behavior concerning pregnant women with gestational diabetes mellitus. Significance of the course. Laboratory or clinical measures are utilized to draw a frontier between non-disease and disease. Where potential, the condition is depicted in expressions of the causal factor or procedure. When this is not potential, the trouble is determined in expressions of its footprints. For example, histological alteration or functional trouble or its prognostic involvements. The simplification of action, context, target, and time is to some extent qualitative. For instance, assume one was concerned in anticipating whether a pregnant woman with gestational diabetes mellitus will always have an appropriate glycemic control in the period of pregnancy or not. More specifically, suppose that within months from now, we ask a pregnant woman with gestational diabetes mellitus whether she did or did not always follow her physician's directions accurately during the past months. Method of this course. This course improved and tested a pattern established on the theory of reasoned action to grasp the troubles that occur with pregnant women who have gestational diabetes mellitus and their demand for ideal glycemic control. Theory of reasoned action, anyway, is a chain of related notions and hypotheses supposed by public psychologists to foresee and to comprehend individual behavior. Commonly speaking, my course renders as an extension for the current literature concerning pregnant women with gestational diabetes mellitus. Despite of the truth that theory of reasoned action was widely utilized to debate the motive of different reasoned actions, my course might become a pioneer in utilizing theory of reasoned action to debate the behavioral pattern for pregnant women with gestational diabetes mellitus exercises and discussing the pertinence of theory of reasoned action established on available data to accomplish ideal glycemic control and thus far promoting pregnant women's health. Regardless of how one seeks to determine a behavior, the time that behavior has been determined, a reasoned action tactic proposes that an alteration in any one of the previous elements, action, context, target, and time, alters the behavior under contemplation. Thence, from this side, one does not accomplish the similar behavior in various contexts but alternatively performs various behaviors. For instance, following a particular diet and performing physical activity is a very various behavior than following a particular diet and performing physical activity together with taking insulin or any other anti-diabetic agents. This actually depends on what the pregnant woman with gestational diabetes mellitus needs to have an ideal glycemic control. Results and conclusion in this course. The issue is either that pregnant women with gestational diabetes mellitus do not own the substantial skills, abilities, and knowledge, or that there are inner or exterior obstacles prohibiting them from performing on their intentions. However, in these situations, The suitable interference is not one outlined to alter attitudes or to impart awareness, but one guided at skills, constructing or at assisting them evade or overcome obstacles. Who this course is for? It's appropriate for people from all the world who have an interest in developing approaches, clinical pharmacology, physiology, social behavior, health education and behavior, health promotion, nutrition, obstetrics and gynecology, endocrinology and metabolism, medical sciences, clinical pharmacokinetics, therapeutic drug monitoring, clinical chemistry, clinical therapy, biochemistry, pathology, laboratory sciences, epidemiology, etiology, human relationships, pharmacotherapy, quality management in healthcare, theory and research, women health, clinical research, pathophysiology, diabetes research and clinical practice, social psychology, and teratology. And this course contains 55 resources. Many thanks for your attention, and I'd like to invite you to enroll in this course or try the free preview if you want to explore further.